off with Jon Schull. Jon, as co-founder of Enable, has led a global network of volunteers to develop open source 3D printed prosthetics to those who need them. And he gives them away entirely free. In former lives, he has been a biological psychologist, a digital rights management entrepreneur, an inventor, and a professor. And therefore, it is a great pleasure, Jon, to be hearing of your experience and what you've been doing as well, especially for COVID-19.
Thank you. Thank you. It's a pleasure to be here. By the way, I have a little bit of laryngitis, so usually I sound wonderful, but now I'm sounding a little hoarse. I want to salute you for what you're doing. I think this is a great thing, and I want to salute you in particular for titling this How to Fund Your Project rather than How to Fund Your Business, because I just wanted to point out that those are really two different things, and the critical thing is to fund your project. I thought it might be useful to talk a little bit about what I've come to think of as Enable's secret non-business model, because we've managed to do a great deal without actually funding a business, almost without funding our project, which is to say funding is only a piece of the puzzle. Our recipe involves open source designs that are used by volunteers to produce freely donated devices, which are delivered with responsible end user guidance and disclaimers of liability. Now that 5-point recipe has allowed us to proceed basically without funding, to have minimal regulatory and liability burdens, and to reach people, reach precisely the people who established institutions, governments, businesses, and NGOs have failed to reach, the underserved. Governments, businesses, and NGOs are great, but they're not perfect, and therefore where you find underserved populations is precisely where none of them reach. And a global network of volunteers, it turns out, can do things and help people that established businesses, established governments, established NGOs can't reach. So it's been very interesting thinking about how the Enable model may or may not be relevant to the current crisis, because the current crisis is really highlighting a number of things that I think we happen to be well positioned now to notice. So I have a little sermon. I know I've only got 5 minutes. I think I'm about halfway through it, on sharing and caring, right? In the open source business, we like to say that sharing is caring. And you'll notice that these elements, volunteers, open source, good documentation, disclaimers of liability, and giving it away for free are all very conducive to sharing and sharing of good stuff. With this model, actually, we have found we can lose money on every sale, but we can still make it up in volume. We can mobilize volunteers. We can inspire people to do better and be better. We don't need a business. We have created new products and businesses as a side effect. But I want to point out that as soon as you create a new product or a business, you also become part of the healthcare industry, and you become subject to institutional barriers, which are built precisely to keep institutions from ruining things. And so a non-institutional approach, which I think is particularly relevant to the kind of distributed maker community that we represent, is really something to pay attention to and to focus on at this particular moment. I want to point out that this particular moment has also forced us to realize that while sharing is caring, not caring is also sharing. It shares two terrible things. If you don't care and you don't wear a mask and you don't social distance, you spread, you share the virus. You also share an equally insidious disease, the disease of not caring. And we've seen in this crisis that the disease of non-caring can be fatal in the short term. And we're also seeing that we're in this pickle because the disease of not caring is fatal in the long term as well, which is to say the healthcare industry, which is a miracle of modern science and a pillar of civilization, and which will help us treat, cure, and understand the disease, ain't gonna do it anytime soon. Also, the healthcare industry, this is not a blanket condemnation, but it's a real warning. It profits from illness, and profit breeds inequality, and inequality breeds the illness. The present situation is a failure, not just of the medical system, but of our larger system. And furthermore, it's such a massive failure that we have an opportunity to rethink the larger system. That's why I've dragged the Enable model into here. It's a different kind of model. It has done good. It's not a replacement for any of the things that we've come to rely on. But I want to urge us to think about getting useful stuff out there and not assume that funding or business is the be all, the end all, or even necessarily a requirement. So that's it. That's my sermon.
Wow, and a powerful sermon that was, really.